what is your role in the bonding process? The process which a parent and a child come to love and accept each other is called attachment or bonding. Your client and her family begin their attachment to the fetus during pregnancy, and it intensifies just after the infant's birth. This relationship is developed and maintained by contact and interaction with the baby. Family-centered care is an approach designed to facilitate bonding and integration of the baby into the family unit. With this approach, early parent-infant contact is encouraged. After delivery, the baby is in a quiet, alert stage, with open eyes seemingly to gaze directly at the parents. The baby also responds to voice and touch at this time, so this is the ideal time to promote attachment. To facilitate bonding, continue to keep the mother and the father with the baby as much as possible. During the first hour after birth, parent-infant contact is important, but sometimes this is not possible. When appropriate, reassure parents that although the attachment process is delayed, it will still take place, just as if they were there together at this time. Bonding behaviors include the face-to-face position, calling the baby by name instead of it or he, identifying the baby's unique characteristics and pointing them out to other family members, talking directly to the baby, and holding the baby close to the body. You can certainly promote attachment behavior by role modeling and pointing out the baby's responses to parental stimuli. When the baby is born prematurely or has congenital anomalies, your client's anxiety and expectations for her newborn can affect the bonding. If a mother's fantasies about the child she imagined she'd have are in sharp contrast to the reality of the actual infant, attachment may be seriously delayed or impaired. If the infant is the result of a violent or abusive circumstance, the mother might also bond slowly or not at all. Impaired bonding may stem from maternal alcohol or substance abuse during pregnancy or after delivery, and adolescent parenting. What parental behavior reflects a positive bonding process? Parents who are bonding successfully hold the baby close to the face and look into the baby's eyes. They talk, coo, and sing to the baby and call the baby by name. They will assign meaning to their baby's actions and physical characteristics. These parents touch their baby in an orderly fashion, progressing from the fingertips to the fingers to the palms to holding the baby close. They verbally claim the baby as a member of their family. What parental behavior indicates problematic bonding? Sometimes a parent has difficulty bonding with a newborn. The signs are fairly obvious and include ignoring the baby's presence or turning away. Other parents awaken the newborn or handle him roughly. Some parents even express disappointment or displeasure with the infant, especially when he urinates, has bowel movements, or spits up. These signs are problematic when they become patterns. Isolated incidences or verbalizations do not necessarily mean that the parent will not bond with the baby eventually. So be sure to evaluate negative behavior in the context of a pattern and assess the situation carefully before making unfounded or hasty judgments. Other more subtle signs are the lack of awareness of the baby's needs or preferences. You have a vital role in helping the parents bond with their new baby. Point out the baby's unique characteristics and encourage the family to hold, cuddle, inspect, and feed the newborn. When giving the baby the initial bath, call the parent's attention to the baby's normal newborn reflexes and abilities. Remember also to be culturally sensitive and to accept and promote safe child-related customs that differ from Western traditions. When bonding fails, the baby is at risk for abuse and neglect, including physical and emotional abuse. Poor attachment or lack of attachment may lead to a poorly nourished baby that can fail to thrive. Emotional well-being is necessary for healthy growth and development. How should you respond to delayed bonding? In the following situation, identify the indicators of delayed bonding, formulate a nursing diagnosis, and prioritize the mother's needs at the time. A 14-year-old gave birth to an infant boy 3 hours ago. It was a vaginal delivery, and KV has a midline episiotomy. She asked you to take the baby to the nursery for a few hours, saying, "Please take care of it for a while. I am exhausted. I was in labor for 16 hours and had no sleep at all last night. I really need to sleep. The baby is lying across her lap, and she does not enfold the baby before handing him to you. The signs indicating that there might be a problem with bonding are: the mother is not holding the baby close, and the mother is calling him it. She focuses her attention on her own needs over the baby. The appropriate nursing diagnoses for this situation is risk for altered parent-infant attachment related to developmental level, fatigue, and pain. The prioritized needs of the mother are rest and sleep, interaction time with the baby to facilitate bonding, practice in holding and cuddling the baby. Prioritizing her needs, you know that this young mother must get sleep and rest before she can accomplish the other tasks. Because she shows sign of delayed bonding and is very young, allow her time for sleep and rest. Then support her in adapting to her new maternal role. To help this client adapt, role model cuddling the baby and calling him by name. Take him to the nursery so the mother can rest. Explain that it is important to spend time with the baby, especially in the first 24 hours after birth. Give the mother a bath demonstration and discuss the baby's characteristics and reflexes. Assist the mother in infant care, but giving her support in giving care to herself, and assess for other signs of delayed bonding.